Coming up next, Sitting at 30 takes you downtown for the weekly luncheon meeting of the City Club of Portland. Live weekly coverage of City Club is made possible in part by TCI and is produced through the facilities of Portland Cable Access. Now we join the City Club for this week's program.
And the Urban League Equal Opportunities Award. She's a product of the University of Portland and Portland State University. Her time with the state has been through 4 governors and countless sessions of the legislature. I am sure you'll miss them. Kay, when the fastest growing segment of our population is over 100, why should we spend time with our kids? Kay.
Because our kids are our future and our elders are our foundation. That's why. Good afternoon, and thank you so much for that introduction, and thank you to the City Club for the opportunity to speak with you this afternoon about Oregon's children and families, or children and families in general. In preparing for my remarks this afternoon, I could not help but reflect upon why I felt such a sense of mission and a sense of purpose while I was the head of the State Office for Services to Children and Families. Certainly over the 30 years that I spent in state government, I had other challenging positions, other positions that by their nature were controversial when I was Director of Affirmative Action, but never did I feel the sense of urgency that I felt around the mission for the State Office for Service to Children and Families. The sense of urgency that it was absolutely essential that our agency perform well, that we be clear about our mandate, and that we intervene as effectively as possible into the lives of our children. And as I reflected, I remembered how it was when I first came into the agency about 9 years ago. And as I talked to branch managers, and as I talked to caseworkers, as I read case files and reviewed sensitive issues, I have to say I was shocked. And for a professional social worker to say that one is shocked is quite a statement, because professionally we're working with society's problems. But I was shocked at the horrible abuse and the chronic neglect that many of the children of Oregon are living in. So today I come before you with a sense of urgency about our children. It's not a message of business as usual. It's a message of challenge, it's a message of change, and it's a message of hope. Recent published reports have indicated that gambling has become the #1 recreational activity for Oregonians. Whether it's the casino, keno, video poker, or Powerball, Oregonians are betting with the hope that they will hit the winning combination of their get-rich-quick fantasies. This is done, however, without taking into account the hidden cost of neglect of our children, abuse in our homes, and the overall cost of addiction itself. Well, I believe that with the children of our state, we have also become like riverboat gamblers. We have become like riverboat gamblers with our children's futures and with their lives. The cost, like that of an addictive gambler, has been great. It is as if we have decided that the future of our children will depend on the toss of the coin. Heads up, they win. Tails up, they lose. But in either situation, the child does not have a choice in terms of how that coin toss will affect their lives and their future. Like the coin in a game of chance, on one side, we have young people who are successful. They're smart, they're idealistic, they're academically sound, and they're quite talented. They're goal-directed, well-supported, and receive supportive recognition. They're not caught up in the negative behaviors that trouble so many of us. For these youth, there's a bright, promising, positive future in their dreams. But on the other side of that coin, there are children and youth who are damaged because of abuse and neglect and many other negative kinds of behaviors. They are children who come from troubled families. They are the children who are the victims of abuse and neglect. They are the children who have inadequate health care and poor options for child care. They are the children who are exposed to alcohol and drugs. They are the children who become teen parents. They are the children who are harmed by poverty, and they're the children who are hurt by discriminatory practices. The toss of this coin will determine if these children have a positive future. But all too often for these children, the coin is tails up. This is indeed a sad paradox that one of the richest countries in the world, we have children going to bed hungry, living in crime-infested neighborhoods, and living with fear in their own homes, living in fear within their own neighborhoods, and living in fear within their own schools. So like the addict caught up in the web of gambling, our children and our families are paying the price for our neglectful behavior. So what is their challenge? What is the state of our children? What are the factors that are contributing to the troublesome behavior that we see in our children? First, the problem of child abuse continues to pose serious risk to the developing child. In 1997, nationwide, there were 3 million reports of abuse and neglect. The number of fatalities from abuse and neglect during that same period of time averaged about 3 children per day. 3 children per day nationwide were dying from the hands of their caretakers. In Oregon in 1998, there were 31,000 reports of abuse and neglect. This was a significant increase, unfortunately, over the number of reports in 1996. From that number of reports, there were 10,000 victims. And what is important to report here about those 10,000 victims is that 47% of them were ages 0 to 5. The largest single age group of victims of abuse and neglect in Oregon are infants. This means that in Oregon, we're seeing more and more of our violence directed at our very young. Once an innocent child is the victim of maltreatment, that child is at high risk of conditions such as anger, aggression, violence, depression, and attention deficit disorder. The future of this child is dependent on the toss of the coin because effective intervention is essential in the future of this child, and that child's future is placed in jeopardy if that child does not receive that intervention. And now on the issue of health care, a very basic need in our society. We've made much progress in Oregon with the Oregon Health Plan, and more recently on the federal level with the Federal Children's Health Program. But today in Oregon, we still have about 8% of our children who do not have access to a health plan, which means that they do not have access to health care. The reason they do not have access to health care is because health care in Oregon for our children is dependent on the toss of the coin. If parents have health insurance or qualify for the Oregon Health Plan, or if the child is covered because of some special program, then the child has that access. If not, the child does not. However, since health care is a basic need, there should be no child in Oregon that does not have access to health care. We cannot look at children today without looking at family life. More and more of our children are born to single parents. More and more of our children are raised in single-parent homes. And more of our children are born into divorced homes. The reality is that social reality means that those children will be in need of high-quality, affordable child care. In addition to that, The economic reality in this state and nationwide is that more and more, two parents are required to work outside of the home. Two parents are required to work outside of the home to meet the basic needs of that family. So because of that social reality and because of that economic reality, we are seeing the need for affordable, high-quality child care. Such affordable, high-quality child care is not available to most of our parents. Let's look at the cost of child care. For a child in need of center-based, school-age care, the cost is approximately $200 per month per child. For a child who is in need of infant and toddler care, the cost is about $680 per child per month. The quality of child care that a child receives in this state and nationwide is dependent upon the toss of the coin because it is directly related to the parent's ability to pay. Child care is expensive and almost cost prohibitive for minimum or low-wage employed parents. And if those parents should have more than one child, you can do the math. The lack of high-quality care means that children's health, safety, and developmental needs may not be met. This means that such children will, in all probability, not be school-ready when they turn 6. These children will be disadvantaged right from the beginning as they start their academic pursuits. As we look at our older youth and our young adolescents, we see that they're faced with many, many serious problems. The problem of teen pregnancy continues to be a significant problem for our young, and as a consequence, a significant problem for our society. Even though we have seen some promising statistics on teen pregnancy rate, particularly in Multnomah County, it's in decline. There's still far too many teen pregnancies. From 1993 to 1997, Oregon averaged about 3,200 teen pregnancies per year. And research indicates that for a young woman bearing a child during adolescence, there is a high correlation between bearing the child and long-term difficulties, not only for her child, but for her and for society. The babies are at higher risk of low birth weight and infant mortality. For the mothers, giving birth during adolescence is associated with limited education, reduced future employment prospects, and reduced earning potentials. Again, the future of not only this child, but the young mother is dependent on the toss of the coin. And while we're focused on adolescence, let's look at the problem of youth violence. I think over the last 2 years, we've all gotten in touch with youth violence amongst our teenagers. Children's First for Oregon, a child advocacy group, reported earlier this year that the statistics of juvenile arrest, teen substance abuse, and teen suicide attempts have increased. What is important to report here, however, is that just like last week, here in the city of Portland, it was reported that violent crimes by juveniles is down. It was also reported recently by the Oregon Criminal Justice Commission that the youth crime rate in Oregon has dropped slightly. The commission reports that about 44,000 children, 17 and younger, were arrested in 1997, down from 50,000 children in 1996. That's progress. However, the real troublesome part of the report is that we had 50,000 juveniles arrested in the state of Oregon in 1997. We continue to see far too many adolescents who are violent, far too many adolescents who are aggressive and involved in criminal behavior, and their future before and after that criminal behavior is dependent on the toss of the coin. And while talking about violence and gun victimization, let me report to you another very disturbing statistic. It's a statistic that's reported by the Children's Defense Fund. It says that since 1970, 60,000 children, more than 60,000 children in the United States of America have died from gunfire. That's more than all the soldiers that were killed in the Vietnam War and every other U.S. armed conflict since that time. 60,000 children should cause each of us to stand up in outrage that we've lost those valuable lives. Certainly, there is no future for those children. The toss of the coin is an automatic tails up, with no hope for them or their potential contribution to our society. The odds resulted in a loss for all of us. And as we consider some of the causes that affect the behavior of youth, we must look at the issue of drug and alcohol abuse, one of the most pervasive problems in our society, and for children and adults too. Alcohol is as much a problem as illegal drugs. It's one of the most pervasive. Certainly at SCF, we knew it to be a major factor that contributed to the abuse and neglect that we were seeing. 66% of the children in foster care have parents who have significant alcohol and drug involvement. In a recent survey of Oregon students, it found that, quote, lots of kids are trying alcohol and drugs in Oregon, unquote. The 1998 Oregon Public School Drugs Youth Survey, which included 20,000 students, suggested that drinking, smoking, and using drugs cuts across all socioeconomic levels of kids. It is not just the quote-unquote fringe kids. The future of these youth is dependent on the toss of the coin, because without the proper kind of information and education and sufficient number of treatment programs, the odds would predict there will be no positive future for those that get caught up in this behavior. The challenges that I've described here for you today at times seem overwhelming, even overwhelming for a social worker, but they are our reality. These are our children. So how do we increase the chance in this game that put our children at risk? How does one create more favorable odds when confronted with these challenges? What is our collective responsibility to all of the children in Oregon? What do we need to do to ensure that when the coin is tossed, it's heads up for all of our children? To begin with, we must have a vision that all of our children are important, that they will be safe, that they will be protected, nurtured, and nourished, well-educated, and trained to be respectful of everybody in this very diverse world in which we live. Without this vision, our children will perish. 2 years ago, when I had the opportunity to visit Romania as a part of a U.S. delegation, I was profoundly affected by the experience. It touched me professionally, it touched me personally, and it touched me emotionally. I saw people still responding and reacting to 30 years of communist rule. 30 years where the dictator in charge said to families, if you are unable to raise your children, place them in institutions and the state will raise your child. After 30 years of this practice, and at the time that I visited, there were 100,000 children in institutions in Romania. So as we talk to public officials at the national level, public officials at the local level, when we talk to many of their public servants, we start asking the question, what is the national agenda for Romania? Every official to a person said the deinstitutionalization of our children. Our children are our future. If we don't place them back into homes, if we don't give them a family experience, as a nation, we will not survive. I was stunned because I believe that if I were to ask national leaders in this country, local and state leaders in this country, what's the national agenda, how many answers do you think I would get? I believe Romania will achieve its mission because everybody has embraced it. Everybody is committed to doing what they need to do for their children. We in Oregon and we in the United States have to place our children as a top priority. We can't lose our children because of the toss of the coin. In addition to having a broad vision that embraces all of our children, we must invest in prevention. Programs such as the Oregon Health Plan must be guaranteed in such a way that every child in Oregon will have access to health care. We must also expand successful models that we know are working well. Models of programs like Healthy Start, which currently is operated by the Commission on Children and Families and is in 12 counties. That program provides a professional worker to follow up with every newborn mother who desires such follow-up for 2 years, so that when the baby is born, there is a professional who works with the mom in the hospital and then says to the mom, I am willing to track you, follow up, do home visits for the next 2 years to help you as you adjust to your new child. We need to bring programs like Healthy Start to scale. They work. It's in 12 counties. It should be in 36 counties. We also have a marvelous program that's working here in Portland, Friends of the Children. And I'm pleased to see Duncan Campbell here today because I was really touched by the article on him in the Oregonian and to get in touch with what has motivated him to support and to develop a program that will make a difference in the lives of our children. With Friends of the Children, a professional friend is provided to a child to work full-time, 7 days a week, 24 hours a day access for that child and that friend. And what that friend is able to do is establish a loving, caring relationship with that child so that when the child has barriers that the child cannot confront, or when that child needs to have a friend to accompany him to something like a grade school graduation, which the parents fail to attend, that friend is able to put his hand in hers or his hand in his and accompany that child through life. And what's so unique about this program and what's special about this program is that the friend makes a 10-year commitment to the child. We need to bring programs like Friends of the Children to scale. Every child who needs a caring relationship that has not a caring relationship in his own home should have access to a professional friend. We must make a commitment that there will be high quality, affordable daycare in every one of our communities. We must make a commitment that all children who are not able to be raised by their parent at home have a safe place in a child care arrangement without the parent. Now, as long as we have a public policy that says women are to work, as long as we have a public program that's transitioning women to work, we should have a public policy that requires an investment in affordable, high-quality child care for all children in need. To do so means, to do otherwise, it means that while solving one problem, women going to work, we're creating another problem. Because we all know that an unsupervised or a poorly supervised child is tomorrow's statistic waiting to happen. Other prevention strategies include family nurseries, supervised after-school and evening activities for our adolescents. You probably read recently in the Oregonian that the hours between 3 and 6 are the time of day when adolescents are more likely to get into trouble. The hours of 3 to 6 is the time of day when young female teens are likely to get pregnant. The reason? Because it's unsupervised activity. We have an obligation to provide those kinds of activities for our adolescents if we are going to be responsive to their needs. We also must make a commitment to training and education programs that get to our young as early as possible about the dangers of alcohol and drug use. We also need to have community discussions and resources available to teenagers to talk about sex education, abstinence, contraceptives, and self-care. We need to provide information and education on how to become an effective parent and the responsibilities of parenting. We put more resources into teaching teenagers how to be good drivers. We require them to be licensed drivers than we ever do about how to become an effective parent. Where are our values? We need a strategy that provides information and education to our young on all of those dangers that may present themselves as they carry on their journey through life. After investing in prevention, we must continue to invest in intervention and remediation. The legislative investment in the Child Protective Services system has resulted in several improvements that benefit children and families. We're in a position to have more in-home services to families that keep children at home without re-abuse, more service for children in foster care for the purpose of reunification, a significant increase in the number of children adopted. And SCF, the Commission on Children and Families, and the department together led a coordinated effort to start community safety nets in local communities. We have community safety nets now in 32 counties, and what that is a coordinated effort to follow up on at-risk families that at one time were reported to the State Office for Services to Children and Families. Because that family or that child's alleged abuse did not meet the legal threshold for our agency to become involved, we decided that local communities had an obligation to at least do some follow-up with those families to see whether or not other kinds of services were needed by the family to prevent the abuse from occurring. We need, again, to ensure that community safety nets are brought to scale. Other intervention strategies include more treatment programs for adolescents who have alcohol and drug issues. We need homeless shelters for youth who are unable to remain in their own homes. We need greater access to mental health and counseling services to address the growing problem of violence and aggression among our young and the growing problem of attempted suicides. Last but not least, we must mobilize our communities to be a part of the solution. We must build supportive environments where youth and families can thrive. We must not let ourselves get into the blame game, but rather to acknowledge that we have a serious challenge that collectively we can meet. A comprehensive and coordinated approach is required. But also, and this is an important also, our personal leadership is required. When we believe that there are policies needed to protect our children, such as gun control, we need to be at the table advocating for those policies because it is in the best interest of our children. When we believe that there are policies that hurt our children, such as Measure 11, then we need to be at the table to ask the policymakers to modify those policies. When we believe that we have a policy that says we can throw away our children, we need to stand up and say, stop. It is unacceptable as leaders and those who are committed to our children. When we believe that our children should be a top priority, then we need to say loudly and clearly as leaders that our children are a top priority and mean it and act accordingly. Yes, the challenge that I have described here today is daunting. Yes, for there to be a change in the lives of our children, it will require a major investment. What has taken years to erode in terms of our norms, in terms of our values, and in terms of our behavior will not be corrected overnight. It will take time, and it will take many resources. Dr. Barry Brazelton, who's Professor Emeritus at Harvard Medical School, says this: we're in a national emergency, and no one seems to be paying attention. We must allocate the considerable resources we will need to meet the crisis. We must salvage this next generation if the nation is to have any kind of a decent future. Our children and our young families are the only hope for our future. Collectively, we must assume responsibility for their well-being. For it is now time for us to toss the coin aside and pay full attention to this issue. We must take action to place our children as a top priority to ensure a brighter future for all of us. And I believe we can do it in the same way that we developed a plan to revitalize our cities, in the same way that we developed a plan to protect our beaches, in the same way that we developed a plan to put a man on the moon. We can develop a plan and invest in that plan that protects and saves our children. That is our challenge, and that is our hope. Thank you.
Thank you, Kay Toran, and I, on behalf of all of Oregon, would like to thank you for your years of of wonderful public service, and we're very fortunate to have had you, and I think Volunteers of America is very, very lucky to have you working there. I want my question to focus on the issues around those 47% that you mentioned of the child abuse issues between ages 0 to 5. I've got a couple of questions. One, is that an increase? Is there more reporting, or increased more reporting? Is it increase in drug and alcohol abuse, therefore that is reflected in the abuse to the children? And then the second part, the part that we all grapple with, I agree Healthy Start, it needs to be absolutely blanketed throughout the state, throughout the country. In lieu of that, where and how can volunteers fit in the old village model of the aunt, the doula, the caring neighbor, the assignment as a volunteer where you've made a commitment, not for 10 years like Friends of Children perhaps, but for 10 months, that you will be attentive to the new mother, that you would be present to the new mother and help with those parenting skills and be on the alert for obvious signs of danger.
In response to the first question, whether the increases that the agency was noticing had to do with more reports for more actual abuse victims, it's both. One of the objectives that we had at SCF was to inform the larger community about the issue of abuse and neglect and about each of our responsibility to assume responsibility for reporting. We all know that there are mandatory reporters. The professionals who work with kids who see or notice abuse are required to report. But it also is a larger community responsibility. We should be responsible and protective of all of our children. So we believe that because of our efforts to educate and inform, we were receiving more reports. But we also believe that there were more actual cases of abuse. And the reason for that is because of the problem of alcohol and drug abuse. Unless and until we are able to solve that problem, much of what we're doing in our agency, corrections, and the other helping professions is a Band-Aid. We are seeing an increase in the problems of alcohol and drug involvement, and as a consequence, we believe we're seeing more violence directed at children. And on the second question, which was, can the community or volunteers become involved in this effort? Absolutely. I operate from the premise that we're all responsible for all children. And I think if there are volunteers who can play a role in working with families, helping families, helping families, that we will see more abuse rates and numbers in decline. I also believe that the faith community and other voluntary organizations can play a role in helping with this problem by being available, supporting moms, helping out when mom needs respite care and can't afford to pay for it.
Good afternoon. Matteo Luccio, City Club member, and I work for the Multnomah County Department of Community and Family Services. Okay. You talked about children, of course. You mentioned mothers, community, state, local, and federal authorities, and adult mentors to whom you referred with a masculine pronoun. What about fathers? Absent fathers, what are we doing, what can we do, what should we do to assist them and obligate them morally, legally, whatever, to do their duty? And why do you think so many fathers are absent from the picture in the first place?
I'll start with that last question first, because I believe that we don't do a very good job or a very effective job in our society of helping young people recognize the responsibilities of parenting. I think we need to have parenting programs for women, young women who are going to become mothers, but we also need to have parenting programs for young men to help them recognize what responsibility they have to their children. I don't know, quite honestly, how you motivate a father to be involved in a child's life. I don't have that answer. I just don't know that answer because it seems to me very odd. But I do believe that we've got to put resources before children are born into the hands of young people so that they understand the responsibilities of parenting, the responsibility of early sexual involvement, and the responsibilities they will have to a child that they are the mother or the father.
Okay, thank you. You have a dream, and you've asked us to share that dream, and you are a treasure to us all. You've also given us a huge challenge. If the things that you've described are truly needed, and I think most of us here would say they are desperately needed to help families and youth, then how can each of us answer your call and begin to pick up that challenge in specific, important ways and confront the apathy, the widespread ignorance, and the lack of courage and commitment to the needs of families and youth that seems to exist among the public and among our elected leaders?
Thank you. I think there's a perfect opportunity for the City Club to take responsibility for this movement, this campaign. I think members in the City Club have access to resources, financial and human, that would allow them to take on this campaign, and I think it is a campaign, that says to every policymaker, whether it's in the private sector, the public sector, or the nonprofit sector, that our children are a top priority. I heard in a gathering recently this statement, that if every policymaker, regardless of what sector, before he or she had a policy approved, would ask the question, how does this affect children, we would get there as fast as possible. And it's the simple steps. But I do believe the City Club has voices, they have access, they have resources, that they can take this challenge on and begin to mobilize our community to say that our children are the top priority.
Hello, I'm James Ward, Dean of the Graduate School of Social Work at Portland State University. And as you know, we are very active in providing well-qualified personnel for children's services, doing substantial research in that regard, and we hope to continue, and we've worked collaboratively with you in that regard. I was intrigued at your presentation and liked it very much, particularly as you talked about the tossing of the coin. And I want to focus upon one aspect, and that has to do with health care for children. What's at the base of my concern is that we see no hope for those children that you mentioned who have no health care now, based upon what's happening in the political arena. If we do not get funding for the health care plan that would cover this population group at a time when the federal children's health insurance program is allowing for nearly 1-to-3 match, what will happen to those persons who now do not have any kind of health care coverage, and what are some things that the City Club can do to bring this about, to make sure that they do have health care?
Thank you, Dr. Ward. I'll start with the second half of your question, because one of the campaigns that was very effective in our society, and all of us are aware of it, was the MAD campaign. Do you remember when everybody used to go to the cocktail hour after work and drive home drunk? And MAD said, no more. Stop. This cannot happen because kids and people die. And we all put those red ribbons around our antenna. And today, wherever you go, people know this term, DD. What does it mean? It means designated driver. We were able to turn an activity around drinking by saying that it was no longer socially acceptable to drink and drive. I believe we can have the same kind of campaign with the whatever color ribbon that says to every policymaker that if there are available resources for our children, and our children need those resources, you can't come home unless you dedicate those resources to our children. It will take an effort. It will take leaders being at the table in Salem or wherever those policies are made to say, this is a priority and we're going to hold you accountable.
Are you going to say anything about what would happen if we don't get a health care plan in place or health care funding?
Well, I think in a lot of ways that answer is quite obvious. I think if children don't have health care, their health needs are not going to be met. Children are going to be sick. Children are not going to be healthy to be able to take on the challenges that they have to face. So if we don't do, children will be hurt. And that's the answer. Yeah.
Hello, my name is Sharon Joy, a City Club member, and I think early intervention, even before birth, is extremely important. So this event concerned me, and I wondered what you would do about it. I walked up to somebody sitting on a bench that had a push cart and wasn't as old as me, but was getting there, and looked very tired and poor, of course. And I asked her if she would feel insulted if I gave her some money. And she said, oh no, she'd be very glad for it, because she was a schizophrenic, a diabetic, pregnant with her 13th child, and could not maintain her profession, which was prostitution. What I'm wondering about is our society intervening too late? 13 children without father or mother, when I think a birthright should be both, and responsible ones that are able to take care of them. What would be your solution for that?
Right. Again, I want to go back to my comment that we needed to invest resources in prevention programs, information and education programs. I think young people need to recognize the responsibilities they have to their own bodies, particularly young women. We don't do a very effective job at that in our society. Mothers don't do it because of the embarrassment that goes along with it, and there wasn't permission to talk about those subjects at one time in our society.
But in this case, she's not capable of understanding, even if you did educate her. And all she knows is she needs the money for the prostitution, through the prostitution. What I'm talking about is some things you can't educate. You have to somehow help people through these things. In other words, education doesn't do everything.
Education doesn't do everything, but I think you have to start there. There's probably someone in her life at some point in time that had some responsibilities for her. And even in that process, whether that was a parent, whether that was a caretaker, they had some responsibilities to her to talk about what and how she used her body.
John Leeper, City Club member. I commend you for your past efforts and your future efforts as well. Thoroughly enjoyed your program. I don't want to sound like a skeptic, however, I have seen enough in the way of statistics to view them with a wary eye and wonder what your perspective is on the level of reliability on child abuse and what you think there might be in the way of underreporting of those statistics.
That's really an excellent question because I think as a professional and somebody who worked in services to children and families, I believe there is underreporting. I think people are not willing to take the risk to report somebody because it's often somebody they know, often a loved one, that they believe is abusing a child. I think they're uncomfortable with it. I think they know that they should do what's in the best interest of the child, but to take that step to get a public agency involved is not the step they're willing to take. That's the reason why we do have the mandatory reporter law. If the child goes to school, we at least know that there's a teacher in a position to also look after that child and is in a position to report. What troubled us most is that kids between the ages of 0 and 5 may not be seen by anybody other than the parent that's abusing them. And so there's an unknown there. So neighbors have to take some responsibility. The faith community has to take some responsibility to make sure that others are watching for the welfare and well-being of those children. But if I had to say whether or not children, abuse victims were not being reported, I'd have to say yes, I believe that. Tom.
Tom Hogan, City Club member and former SCF employee. Thank you for your message today. Part of my question was this lady's too, about the role of the City Club in the larger leadership issue. Do you also think that there are ways that the City Club could actively support the mission and the activities of SCF?
Oh, well, yes. I think that the City Club could probably partner with the State Office for Service to Children and Families by helping to get the word out about the condition that our children are subjected to, particularly when they're the victims of abuse and neglect. There is a factor that I think most of you can understand. There are probably some people who can't believe and certainly can't conceptualize that an adult would harm a child. And I think that's the reason that when I started my presentation, I talked about being shocked. When you listen to the CARES presentation, Legacy Care, Northwest CARES at Legacy Emmanuel, that might be a City Club presentation that you would like to hear and see. Because when Dr. Keltner brings her slides, not of actors, but of real children who have been abused, it will leave an impression that's an indelible mark on your life forever. And that's what our caseworkers see every day. They see it every day. They see the little kids that have been burned on their backs by cigarettes. They see the little kids who have been violated sexually, their innocence stolen forevermore. They see the kids who have been bruised in the eyes because mom or dad or their caretaker couldn't stand the stress of the scream of that child. Well, when you've seen that, you know that it's real. But I do believe that there are people who don't ever see that and don't recognize that we have a real problem. So the City Club has the kind of credibility and the kind of membership that if you were also to become a loud voice about abuse and neglect, I believe that message would be heard.
I'm Martha Radakovich, City Club member. I certainly agree. This is a vital effort that I am so glad to see that more are joining the wagon to help solve this problem. But I think it's actually a two-point problem too. What about responsibility? Where is the responsibility that we're instilling in our children, ourselves, our society today? That seems to be missing. And without these missing things, I grew up during the Depression. Everybody was poor, but everybody wasn't drunk and beating up on each other either. So I think that there is a very great need for us to help to spread this one attitude of, I am responsible for what I do. And thank you very much for your wonderful words. And I want to be on the bandwagon too.
Thank you. And I think that she raises a good point, because it's probably in the back of all of our minds. What responsibility does the individual have in terms of addressing this problem? I mentioned in my remarks that we can't get into the blame game, but individuals do have some responsibilities, and we do have to hold individuals accountable. But in addition to that, we have to look at the processes and the systems that have contributed to people not being able to function as effectively as they need to in our society. Systems that have contributed to dysfunction, systems that have contributed to people not being able to be employed, not having the educational skills to be employed effectively, not having the kind of knowledge necessary to be able to be competent in a job, not having the information to know how to raise a child. So the individual has to be held accountable, but we have to hold ourselves accountable for the processes and the systems that have contributed to the problem.
Judy Nichols, City Club member. Kay, I'm delighted that you will be with Volunteers of America. I'm here representing the Salvation Army. And both of our organizations, as with many other faith-based and charitable organizations, work on the front line of human services. However, I'm concerned in recent years that there seems to be an assumption that as government pulls back, we can fill the void. And I would like to suggest that we narrow your campaign focus for the City Club to really put the pressure on the public executives, the public, the government, to take up its role so that we can continue to be a partner to it, but not be driving the effort.
I think that's a good point, but I do want to say that for us to solve this problem, it can only be solved by effective partnerships and real solid collaboration. It's going to take business leaders. It's going to take leaders from the public sector. It's going to take policymakers. It's going to take all of our resources, foundation community, business community, tax payers' money, public money. It's going to take all of those efforts and resources for us to begin to turn this problem around. It's no one agency or organization's role to be in the forefront. It's all of our responsibility to drive that vehicle together.
Ruth Curry, City Club member. Hi, Kay.
Hi, Ruth.
I missed most of your, all of your presentation, but got here in time to hear part. Some years ago, I'm reading a book on child abuse, and in the foreword by a prominent psychiatrist, he said that he felt that even though he was writing the book, he felt the worst child abuse was by the laws governing welfare. And I don't know whether you addressed anything or have any comments on that in terms of what welfare is doing or lack of welfare.
Okay. We're seeing changing policy as we speak about how government responds to women particularly who are in need of financial resources to live from day to day. In the 30s and the 40s, it was the philosophy behind lawmaking that a woman's role was to stay at home and raise her child. And as a consequence, the Aid to Family and Children, the Aid to Dependent Children's Program was created to help women who didn't have the financial resources to take care of their family, and the government would pay financial assistance to help with that responsibility. We've seen now where the philosophy behind that has changed. Now government is saying that we want women to work, and we want women to work to be able to take care of their children. I think that goal and direction is correct. What's missing, however, is the dialogue and the discussion and the resources about what does that mean for the child. Again, I thought the Oregonians article a couple Sundays ago that talked about the need for follow-up studies to answer the question, are the women in poverty? Are the children in poverty? And if so, what do we do about that? I would have to believe that a minimum wage parent working today who has 1 or 2 children is probably still in poverty. But what we need to say in addition to that is, what do we do about it, and what do we do about the children who are living in poverty? So that becomes our responsibility, is to take the policy and say, how do we make it work so that we don't disadvantage the women and the children who are part of the transition and becoming self-sufficient? It's not an easy answer, because I believe we have an absolute obligation that's non-negotiable to make sure that the children of those moms are well cared for, that they're not living in poverty, and that they're safe and protected. And that's the part of the discussion that has been missing with this new change in public law.
Robert Phillips, I'm a visitor. I decided to get one visitor in since most people coming up were members of the City Club. What I'd like to do, first of all, is thank you, Kay, because in responding to many of the questions, and I was sitting there listening, I said you almost had to have the wisdom of King Solomon to come up with some of the answers. And when thinking about that, I said, wasn't it interesting, because one of the scenes involving King Solomon involved a small child with 2 parents making the claim for that child. One, the real mother, one, a person claiming the rights to the child because her own child had died. And it was a very difficult kind of case. And when King Solomon looked at the situation, he said, maybe the best solution here is to cut the child in half. The person who was not the mother said, that sounded like a great idea and great wisdom. The real mother said, no, give the child to her. And I think your challenge, and she did that because she cared and was concerned about that child. And I think the challenge that I heard from you today in relationship, in many cases, to that same scene, is that we be like that mother, the true mother to that child, one who was caring, one who was concerned, and one ultimately who was willing to make the sacrifice if that would save the life of that child. And so thank you very much for your comments.
You should give the next speech. Thank you. Time's up.
Thanks very much.
Thank you so much for being a partner with me this afternoon.
Thanks very much, Kay, for an outstanding presentation.
Thank you.
We're adjourned. We'll see you next week.